This patient has a bad bite and it's causing bone loss and gum loss in this region. So if we look at why the bite is bad, the top and bottom teeth are directly on top of each other in the front. We call that an edge-to-edge bite. And then this tooth in particular is behind the lower teeth, which is what we call a cross bite. If we look, that edge-to-edge bite is already causing some chipping of this tooth here in this region. And if the patient were to open his mouth, you would be able to see that the lower teeth and the upper teeth are all worn unevenly. He also has some crowns here in the back sections. That's not a problem. But this bite, that edge-to-edge bite, just pushes the upper front teeth, push on the lower teeth downward. And if we zoom in here, you can see how the gum is starting to recede in this area, and so is the bone. And so you're starting to see this darker area in here. That is the root surface of these teeth. When we bite down, all of the force and pressure of our chewing and biting should be on the back teeth here. If any of that force is put on the front teeth due to an edge-to-edge bite, the teeth are affected, the bone is affected, so is the gums and the root. So you will start to see them receding, including the upper teeth as well. And the teeth will continue to wear down with time as patients age. So what we need to do is take those upper front teeth, move them forward in front of the lower teeth and covering them a little bit. Not too far forward, creating what a lot of people talk about as being an overbite, or too deep like this, which that's a true overbite. So we want a perfect amount of overlap on the top and bottom. So we plan on doing this with Invisalign for the patient, so we can not only straighten the teeth, make room to bring this tooth here forward and get all of the upper teeth in front of the lowers, so that we can prevent these gums from receding any further, including the bone. Now, once we do that, the patient will have to keep getting maintenance appointments with their periodontist specialist for the health of the gums and the bone long term, but at least we'll put the teeth in a more favorable position so that they're more stable long term, and the teeth and the bite are easier to maintain.